Hello and welcome. We are just opening up today's broadcast. Thank you for joining. Thank you for being here as we open the top of the hour here and learn more about this topic in digital transformation in healthcare opportunities and challenges. Today's virtual fireside chat will be a discussion between John Glasser and Ranil Herath, related to this topic in digital transformation. And as you think about digital transformation, we'd also like to introduce you to this program here, Leading Digital Transformation in Healthcare. If you'd like to learn more after today's educational session, if you'd like to dive more into detail, we'd love to tell you more about this program. So after our discussion here today, after our fireside chat, please do stay tuned to learn more about this program and other opportunities such as this one to learn more. So with that, we want to set the stage here and tell you a little bit more about Harvard Medical School Executive Education, where we engage business leaders such as yourselves whose work impacts healthcare and exposes them to the real world practice of medicine, cutting edge biomedical sciences and technology, perspectives of patients and physicians, and future trends in healthcare delivery. So that's what we're doing here with this fireside chat, as well as this program, working with world-renowned faculty here at Harvard Medical School, offering experiential, customized programs and other educational opportunities for organizations, open enrollment programs for individuals and teams. So through these opportunities, you can become highly sophisticated within the domain of healthcare, developing a forward-thinking business strategies, and ultimately delivering products and services that improve the lives of patients. So far-reaching impact here as we partner with Harvard Medical School to learn more about digital transformation and what's on the horizon. Very pleased to have here with us our two speakers. So thank you all again for joining. Welcome. And I now invite into the spotlight our two keynote hosts and stars of the show, Ranil Herath, President at Emeritus Healthcare, as well as Dr. John Glasser, who's the Executive in Residence at Harvard Medical School Executive Education. So thank you both for being here. I'll go ahead and hand it over to you for our keynote address.
Wonderful. Thank you, Marie, for that great introduction. I'd like to extend a very warm welcome to all the participants today joining us for this fireside chat. And also, I'd like to welcome John for taking his time to join for this discussion. I'm Ranil Herath, President Healthcare at Emeritus. I'm very excited to be having this candid chat with John and dig into digital transformation in the healthcare landscape. John, you have a fascinating background with some rich experiences. I believe the audience would enjoy hearing a bit more about your background. Could you share a little bit about your journey and some of the experiences you had along the way, like what roles have you served in, and how you have become a much sought after expert and thought leader in this space?
Well, I'd be happy to do that. And first of all, nice to join you and Marie and the rest of you on this conversation. I've been in this industry of applying digital technologies to improve health and healthcare for a little over 40 years. And it began with a PhD in healthcare informatics, and then involved roles where I ran the healthcare IT consulting practice for Arthur D. Little, was the chief information officer at Mass General Brigham for 20 years, ran the healthcare information technology business for Siemens. We were then acquired by Cerner, and I spent a number of years at Cerner running their population health business. And along the way, it took a year of sabbatical to go work for the United States federal government, where I helped the Health and Human Services put together the Meaningful Use Program, which may mean something to a lot of you, but may not mean something to the rest of you. And I also got fairly involved in a number of the associations. So on the board of the American Telemedicine Association, the American Medical Informatics Association, HIMSS, CHIME, which is the healthcare CIO group, et cetera. And then during that time, wrote a lot. So I wrote 4 books and 200 articles on the topic of, applying the technology in effective ways. And then last but not least, I spent some time in academia, both for 12 years teaching a course in digital health at Wharton, which is the business school of the University of Pennsylvania, and in the last couple of years as executive in residence at the Harvard Medical School. So it's been a real privilege, a real honor who have been in this industry from multiple different perspectives, that of a provider, that as a supplier, that as an academic, that as a government official, and that is someone who's engaged collectively with a number of my colleagues, some of you who I'm sure are on the phone, in advancing the industry through associations.
John. Thanks for sharing that. What great experience spanning across industry, government, nonprofit, as well as various industry bodies. So truly great to have you here. And to get us started, I want us to level set with the audience in terms of, for today's scope, what is digital transformation in healthcare and what problems are being solved? And if you could speak about how does it benefit patients, improve access and care outcomes, and how people need to be
Sure.
prepared for this, I think that will give us a good level setting to get started.
Yeah, certainly. I mean, when you look across industries, financial services, education, agriculture, travel, you just look across them. You say, well, when transformation occurs, it's because the business model of the industry changes in very significant ways. And the business model has two parts. What is it that you do if you're a participant, and how do you do it? So you could be a health system in healthcare and say, I normally take care of people who are sick, but now I'm going to expand that to, I will still take care of people who are sick, but now I'm going to expand that to keep them healthy and well. So I'm changing what I do in a very significant way. And another example is you change how. So if you're an automobile manufacturer, say I make cars, but now how I do that's different. I now have to make electric vehicles, and I now have to make vehicles that are smart, perhaps even to the point where they self-drive, et cetera. So anytime you get a very significant change in the what or how of an industry, you get industry transformation. And sometimes it's led by a particular incumbent, sometimes it's led by a startup, and everybody realizes, wow, I'm going to have to replicate that if I intend to be around for a while. So that's when transformation happens. In fact, we'll probably get into this a little bit later on. When transformation is successful, it's because of that. It's because it's one of the things, because they make a really astute change in business model. Now, the reason digital matters is that if you look across all these, and again, not just healthcare, golly, financial services and education, everything, there's this really strong digital core. In fact, you probably couldn't do it if you didn't have a digital core. You couldn't have the car that is smart, drives itself. You couldn't really keep people healthy if you didn't have some wearable technology, for example. So the digital part is the enabler, is the thing that facilitates this transformation. And when we look at healthcare, there's one of the things that's really quite impressive. And we see this in the course. It's just this amazing variety of approaches. And they range from telehealth, says we're going to now allow you to engage with a caregiver, but you don't have to be in the same place or the same time. We actually even have digital therapies where the caregiver may be a bot that's sort of working with you to handle depression or anxiety. We're now going to put devices on you to help you manage your health, or we're going to use AI to look for patterns in the data that indicate that treatment's hurting somebody, or treatment A is better than treatment B. So you have this range of stuff that can all be applied to improving the quality, improving the efficiency, and the safety and the accessibility of care. And it's really quite rich, fertile ecosystem that's occurring.
That's great, John. So a lot of changes, but I think something that's also significant is in the last 3 years, due to the pandemic and other reasons, I believe some of the transformation efforts and need was really accelerated. So I believe, what would you say your guess would be, what would have typically taken maybe 10 years or more may have happened in a much shorter period in the last few years?
Yeah. I mean, there have been a number of things. It's a good question. People have sort of pondered, of the pandemic, and it's still kind of here and hasn't gone away. But what changes were permanent and what changes were temporary that have occurred? And you could say there's a couple that had really lasting effects, not just in healthcare, but broadly, educating kids, for example, across the board. But one of the things that's been noted across industries and across the globe is that it took whatever your digital health agenda or your digital agenda was, in our case, digital health. It accelerated it by as many as 7 to 10 years, just pulled it forward. And it could be, for example, you're a grocery store and you had an agenda where people could order groceries and have them delivered. Well, that sure got accelerated in the course of the pandemic. So clearly the agenda on place was moved forward. And where you really see that is in the patient experience and in telehealth here. But it's not the only thing that changed. The other is that a lot of providers and health plans had to make decisions much more quickly than they did before because they were just being overwhelmed. So decision-making sped up. They learned how to make decisions faster than they did before. They're also now worried about staffing. And so they say, I can't get enough staff, or the staff are burning out. So I'm really interested in technology that emphasizes productivity, or technology that helps me save money, et cetera. So not only did it speed it up, but it changed in some cases the characteristics of the organization. It made decisions faster. another example, right? They got more used to collaborating regionally. So you say, I have this influx, but I got to make sure, I've got enough beds for everybody and manage, vaccinations that are going on. So all of a sudden, taking my competitors and I'm collaborating with them. I have to, if we're just going to survive this. So we accelerate an agenda. We change the nature of organizations and their decision making, and we changed, in some ways, the portfolio, the digital portfolio that they were interested in, organizations were interested in pursuing. So it's had a lasting effect, in addition to some temporary things.
That's great. And then all of that, what it means is with the environment in which healthcare operates have accelerated its digital transformation, which means the leaders as well as all caregivers in some form needs some kind of upskilling or reskilling as they enter this age where their work environment has changed so rapidly. So that brings me to my next point, which is we thoroughly enjoyed working with you and the team at Harvard Medical School with this program, Leading Digital Transformation in Healthcare, which I believe you are the architect, you are certainly the lead in that program. Talk to us a little bit about the objectives of that program and what it hopes to accomplish.
Yeah, I think, what all of you will find, those of you who are listening, is that, you're in an organization which has to go through some form of digital transformation. In other words, you may not be here in 10 years, or you may be hindered if you don't. And it doesn't matter whether you're a provider or a health plan or, a life sciences compound or medic technology or government, you're going to see it, just as all industries have. So it's going to become a reality. In the organizations that you serve and that I used to serve, et cetera. So the intention of the program is to equip you, and you may be leading this transformation. You may be a significant contributor to the transformation. You may be asked in a variety of roles to help with this. And I think it's important that as you go through, one is you understand a number of things. What's the nature of transformation? So for example, what you don't do, or you don't see, or you see very, very rarely, is the organization goes from here's where we are to a new, shiny future, et cetera, in a very short period of time. It takes years to go through these, and they usually take a step and assess, highly incremental, and it never ends. I mean, it's not like you get to a place that we're done. We can't get any better. The world has not changed. So we help them understand the nature of transformation that occurs. We help them understand why is it successful. It's actually only about 30% of transformations are successful. Quarter just train wrecks. But 45%, they crossed the finish line, but it took longer, cost more, and the results were kind of disappointing. So we talk about, well, why? What is it that organizations do to make them successful? And the flip side is when they fail, how do they fail? Sometimes it's the converse of success, but not always. And then we talk about one of the things that really is critical here is organizations have competencies. They need to be good at certain things if they are to transform effectively, and they have to be good at managing change. They have to be good at managing innovation. They have to be good at forming partnerships. They have to do, there's like sort of 9 skills and practices that we say you have to be good at those. So we talk about those. What are the 9 and what do they look like? And we have case studies that help you understand that. So one of the things we cover, knowing that this is a reality, this is not like something will happen over there, but not to us. This will happen to all of us. Is what does it look like? What does it take to be successful? How do you avoid failure? What skills do you have to have in order to be effective at doing this stuff? And what can we learn? Learn from industries outside of healthcare, but also learn from healthcare itself.
Thanks, John. One thing I've been fascinated with is the lineup of faculty you have, the diversity and the fact that they're from all around the world. Can you share a little bit about the faculty, the speaker profiles, and actually more importantly, like what kind of digital transformation initiatives have they led before coming here?
Yeah. Well, the one thing I should mention in the context of your last question, one of the things we cover, or your assignments, if you're a student in this, is we ask you to create a transformation plan over the course of the course. So we want you to actually begin to outline, and it could be a transformation underway in your organization. It could be something that if you sort of expect that your organization should undertake, et cetera. But we want you to, what are you trying to do? What technology is important, et cetera, and how are you going to address the skill sets that have gone on? So anyway, one of the exercises, in fact, the case study, the capstone, is to complete this. So when we look at, to your point of case studies, One of the things we recognize is that transformation is a global phenomenon. It's not just in the developed countries or in the West or whatever. We also recognize its diversity. So we have case studies that are being presented. We have Dr. Monica Trujillo, who is the Chief Health Officer for Telstra, talk about an effort in Australia to do the personal health record for all citizens. We have Chris Strether, who is the Chief Medical Officer for the London region of the National Health Service, talking about efforts to standardize care across the hospitals within the London region. We have Bertie Oldenbach talking about a large German pharmaceutical company and its efforts to digitally transform itself, both for clinical trial recruitment, discovery acceleration. Daniel Rosato Lede, who is a physician at Hospital Italiano in Buenos Aires, talks about the 20-year digital transformation undertakings of that organization. We have Sarah Vesey talking about Providence Health System, which is a large health system in the West Coast of the U.S., talking about their innovation program and how they put together and invest in technologies and see what technologies are important versus not, et cetera. Dr. Jane Fogg talks about telehealth use within a large physician practice in Eastern Massachusetts. Huguette Diacabana, who worked with the World Health Organization, talks about digital transformation efforts to reduce childhood mortality in sub-Saharan Africa, but also the eradication of polio in that particular region. And finally, Dr. David Ting, who's with the Massachusetts General Hospital, discussing digital transformation as an effort to reduce the burdens that physicians face as they encounter documentation, administrative hassles, et cetera. So a really rich lineup of people from all different parts of the world, bringing very different aspects of healthcare and technology. And one of the things you see above and beyond the differences is the commonality. Is what's common across these things? What are the factors that you see over and over and over again as we go across this?
That's great. And what's impressive is these are industry practitioners from around the world. So you get to see the commonalities and share from those experiences from real practice. I'm going to shift gears a little bit, John, and from the program, I want to ask, what are some new digital technologies in healthcare that excites you the most and why?
Well, I think a couple of things. One is if you look about every 10 years, a new technology arrives, digital technology arrives that changes the world. So in the 60s, it was the mainframe. In the 70s, it was the mini computers. It was the 80s, it was the network personal computers. In the 90s, it was the internet. I mean, Amazon was founded in 1994, Google founded in 1998. In the year 2000, it was the mobile device. The iPhone debuted 2007. 2100, I think, was the Internet of Things. In the current decade is artificial intelligence. So each of these changed the world. Our world is different, obviously, because of the web, and our world is different because of the mobile device. And not only are they different when they arrive, but they continue to be different. So we're continuing to see advances in mobile technology. We're continuing to learn about how to use the web, and even some of the adverse effects like misinformation or disinformation in political campaigns, et cetera. So I'm very excited about the notion of AI. There's a lot to learn. There's issues with the technology of biases and brittleness at times. Nonetheless, there's some extraordinary power here. So I'm all very excited, not only to see stuff that's arriving now, relatively recent, but also our continued maturation of technology that came out in prior decades. And it's not just there, that's exciting. One of the things that's really quite striking now, and having been in this industry for a very long time here, is the sheer amount of energy and resources being invested, venture capital funding, private equity funding, the advent of the tech giants, Google and Apple and Microsoft, and moving in very big ways into healthcare. All of these players, in addition to current incumbents, bring a lot of resources, a lot of money, and a lot of really smart people. So we're going to see this unbelievable explosion in innovation that's going to occur in the next couple of years. And then last but not least, one of the things, and particularly remember going back 40 years ago or 35 years ago, we would have board discussions or senior executive discussions about IT, and they didn't understand it, didn't want to get involved with it. It's too weird, too many acronyms. I don't get it. Making me feel uncomfortable. Just don't screw it up. That's kind of their motto here. But now you have leadership teams and boards who do get it. They've been through these kinds of implementations. They grew up with the technology. They are much more sophisticated, more savvy, more willing to invest, but also asking harder questions about this because they've also seen disappointments. along the way. So there's a number of things that are exciting. The technology is exciting, the innovation level is exciting, and also the maturity and sophistication of the leadership, clinical and administrative, across the board. It means that we're going to do some very smart things in the years to come.
That's great. I want to double click on something you mentioned there, which is the tech giants. So when you think of the tech giants like Google, Microsoft, Amazon, Apple, what role do they play in all of this?
Well, I think we're still sorting that out, and we'll learn as as you point in there. They've been in here before, sometimes in and out a couple of times, but they're certainly in now in a very big way. And again, they're very smart companies. They bring great technology. They bring really smart people, and you can look at that if you're, it doesn't matter whether you're a provider or health plan or life sciences company, say, boy, there's some real assets here I could really leverage. I mean, I can leverage the mobile technology of Apple to reach out to patients, or I could level the cloud offerings of Microsoft or Google, for example, to host my activities. So I can take advantage of these technologies and these resources to further my agenda. One of the things we learn here is when organizations are successful is because they keep the transformation first, and then given that, they look at the technology. So when you look at your transformation vision, you can look across these players, say, that's a real technology assets that I can believe here. So in a lot of ways, they help you advance it. They also, you have to be careful because your competitors using it to advance too. So you say, well, what are they doing? And I have a little bit of rivalry that's going to go on along the way here. So you realize that they're all very different. Apple's got a different strategy than Microsoft, which is a different strategy than Google. There's some overlap, but they're all different. But nonetheless, you can say, I'm going to take advantage of that strategy and advantage those motives to help me advance here. Now, at times, for example, Amazon buying One Medical said, geez, are they going to be competitive with me? Are they going to actually directly compete with me in delivering care? And that may be in some cases that they do that. So it's not only these assets that they bring of technology and smart people, et cetera, but they bring a couple of other assets. One of which is they actually understand consumers better than most providers do. I'm relatively healthy. I see my doc twice a year. On the other hand, daily I interact with Google, and daily I interact with my iPhone. So they have a much better understanding of consumers than most healthcare providers, or frankly, most health plans. So you can learn from them about how to work with consumers and how to, get consumers to make one decision versus another, et cetera. And there are also aspects of them that they're very quick to make decisions. They're very good at experimentation. They're highly acquisitive. They learn a lot. They grow a lot. And we could borrow some of that culture from them. So I think there's a net positive. They're always worried about whether they're going to compete directly with you, but nonetheless, there's a power. One of the things we know right now is when you look at transformations, sort of what my vision is, and say, well, what shapes that vision? Well, there's a number of factors that can. Government regulations can shape it. The government steps in and says, this is what you're going to do, and we'll have to respond. But these tech giants bring two factors in, one of which new technology shapes it. And it can be digital technology. It could be the technology used to make vaccines, for examples, but, taking advantage of technology, but also new entrants coming into your field shapes it. So if you made movies, for example, you're Disney or United Artists. Well, here comes Amazon making movies. Here comes Netflix making movies. All of a sudden, there's a new entrant. It could be an established player, it could be a startup. So they represent two of the major forces that shape transformation, new technology and new entrants. And as a result, the transformation vision and destination will be different. And part of the challenge of any organization is how so? And how do I take advantage of this? And are they going to do anything that puts me at risk? And if so, what do I do about that?
That's awesome. So net positive, and a lot of changes is happening, and there is something that you can be drawn and leverage. You don't have to innovate everything. There is a lot that's happening that is out there for the net benefit of the greater community, which is fantastic. I want to get into this phenomena where innovating new technologies, like we spoke, is one thing, but then implementation and adoption is a whole another story. And this comes to leading organizations through successful transformation. It is usually challenging and often fails. So what are the biggest challenges that organizations face in transformation, and what are the factors for success and causes of failure?
Well, I think they face a number. And as we mentioned earlier, there's, the failure rate is high and a number of things that go under. And One thing I think one way they fail is to sort of regard it as a project. This is a project we're going to do, and 2 years later we'll be done. Well, it is a project or involves lots of projects, but you're never done on these things. We've talked to some companies that are really quite skilled at digital transformation, and they say we just do it all the time. It's like finance, it's like human resource, just part of who we are. And so, one is you can have this wrong mentality. We do the project, it'll be over, and then we go off and do other things. So that's one. The second, when you look across the board, there are three factors. One of which is, we've sort of mentioned some of this, is they put the transformation first and the technology second. So why are we doing this? What's our objective? It could be to improve the patient experience. It could be to reduce the cost of care, whatever it is. And then we look at the technology. Every now and then, not just every now and then, but you get the shiny object syndrome. The company where it gets all excited about blockchain or all excited about artificial intelligence, and they go off and implement it, but they're not really sure why. Other than maybe they'll get interviewed in the trade press or things like that. But no wonder they don't transform, because it's not clear why we're doing this and to go off and do this. So, that doesn't mean every now and then you have to look at technologies. Does this enable us to do things we hadn't thought about doing before? That's very important. But nonetheless, they fundamentally keep the transformation first. So that's the first success factor. The second one is they do have a business model change here that is material. And so one of the ways you get in trouble is you do a sort of incremental improvement. Now, quality improvement, the classic, what we've grown up with, continuous improvement, that's always a good thing. On the other hand, if your steps are too timid, sooner or later, someone blows by you. And that's one of the reasons the newspapers are in such trouble in a lot of these countries, is that, whether it's Craigslist or advertising on, the news websites just blew them away in some way. So they were too timid. They got overrun. They got bypassed in the race around the track. The third is these competency factors that we mentioned, is that they head off to do a transformation when in fact they're not very good at managing change. They're not very good at experimentation. The governance process is too political, too opaque, too slow, etc. And so it's like saying, I want to run a marathon, but I've never trained. Well, you're going to have a trouble in actually completing it or not hurting yourself along the way. So the other success factor is making sure that these skills, these practices have been assessed, and nobody's perfect. But nonetheless, you're taking steps to improve them, et cetera. So those factors, understanding the nature of it, making sure that you hold the transformation first, and making sure that your business model change is sufficiently aggressive without being too far down the path, and then make sure the practices are sound. On the flip side, you get failures, and failures sometimes are because you didn't do the others very well, but they can be things such as you try technology, but it's too early. It's just too crude. It's too rickety. It's too not powerful enough, et cetera. Sometimes the strategy is just wrong. I've got this vision, but nobody cares what your vision is. It's just wrong. And so you can head down the path and realize too late that you were on the road to ruin, so to speak here. And sometimes you get things such as if you're in the travel industry, I don't care what your strategy was. Here comes COVID. All bets are off. Nobody's flying, nobody's taking cruises, et cetera. So you were overcome. By external events. Could be pandemic, could be war, could be recession, could be all kinds of things, et cetera. So there are lots of ways to get in trouble here. There are ways to succeed. Part of the transformation plan is the capstone, and part of it for any organization is to make sure you really study those things. And if you're not where you want to be, is you take the steps to make them better.
Yeah, I'm glad the way how you framed it, where it's transformation first and technology is secondary, so that you have your transformation plan in place, and then technology comes in as an enabler almost, right? So in that process, what management skills? It seems like to do that, you need more management skills, not just technical or technology skills. So tell us a little bit about these skills and the capabilities of the individual leaders, as well as capabilities of the organization that you have to put in place for these things to be successful, and how does it tie into what you teach in this course?
Yeah, we go through, a series of management practices and skills that the organization has to have. And so part of your job, if you were the leader of a transformation, is to work with the rest of the leadership team to say, let's assess these and let's be candid. If we're not very good, let's be candid about that. And let's assess these, and how do we fix them? And that fixing them might involve, we have to retrain people, maybe we have to hire different people, maybe we have to supplement with internal consultants, maybe the tech giants can help us in some of these things, but how do we address these? Now, part of this is you as an individual You may not be involved in all 9. That's a super person that's really hard to come by. But you say, I'm going to really particularly focus on this one versus that. But let me tell you what the 9 are. So one is how do you, being good at assessing technology maturity and architecture. How do you know when it's ready? You can be too early, but you can also be too late on these things. The second is managing change. And as we know, that's very hard to do. The third is that we are organized correctly and have good governance. We're good at making decisions. So decisions are being made in the right place. One thing that you see, for example, in successful transformation is the decision making is pushed as far down in the organization as possible. As much as you can get decisions made in the trenches, you really want to do that, because sometimes you think that people at HQ are the smartest people on the planet. Well, they're all very smart, but they actually don't know what's going on. In a lot of cases, you have to push it down. And that's part of the governance call. The others have to be good at experimenting. We're going to try this. Why are we going to try this? How will we know if it works? How will we know if it fails? If it fails, let's put it out of its misery quickly, learn from it and get on with it, et cetera, but very good at that. And not only you experimenting, but using your business partners to experiment with here. The other is developing the business case. It can be hard. You're in front of a board. You say, we're going to transform ourselves. And everybody says, yeah, that's the ticket. We want to transform. And say, our vision is really fuzzy. It's going to cost a lot of money and consume a lot of time, but and the question will be, what's the ROI? And you'll say, I don't know yet. Oh, that's a hard conversation. That's just a hard conversation to have. And that's so, but nonetheless, you have to develop a business case. How do you do that? The other is realizing value. And so sometimes I think, I used to see this when I was a CIO, we went live, big party. Everybody's all excited. We had a big party. And yeah, sure. You should be excited. It's a lot of work. But the assumption is the value we thought we were going to get happens automatically when we go live. That's not true at all. Some does, but most you have to work it. You have to change processes, you have to train and this, that, and the other. So how do you realize the value? Just continuously obtain and leverage the technology. We're closing it on this stretch, creating a digital culture. When I was at the Partners Healthcare, very mission driven. It was great. I believe in the mission, but it could have moved faster. So it could have been more innovative in some way. So how do you bring aspects of the quote digital culture in to blend with your current culture? Forming partnerships, so because you can't do this all by yourself. And it's not just with the technology companies, it's with your colleagues, your editors, perhaps with government. You look at the current telehealth, part of the partnerships formed are with government to relax certain regulations that go off here. And then last but not least is accessing external factors. To what degree is the economic environment and the right for this? So what we do right now is we go through all 9 of these and we talk about it. This is what they look like and this is what they mean. The second part is as we go through the case studies that we mentioned before, whether it's Monica or Chris or Hugh Gett, you'll see these factors in play. You'll see Jane Fogg, for example, talk about here's how we organized, here's how we did experimentation, here's how we defended the value, et cetera. So you see them integrated across a case study, in effect. And then the last part, which is we've mentioned before, your capstone project is to say, all right, I'm going to lay out a high-level plan for a transformation. What are we trying to do? How are we going to do it? And I have to, as the weeks go by, address these factors. What am I going to do, or what do I think we should do to make sure we manage change correctly? And how? Well, what partnerships should we form and why? So we're going to actually we're going to suggest that you apply these in a real context. So to help you really understand these factors and both what they mean and their importance.
That's great, John. Thanks for sharing that. I mean, what impresses me is this, we have an incredible faculty lineup with these experiences, and it's amazing how much you packed into this program to the extent where you are ending with a workable plan that the participants walk out with. So that's quite amazing. We are going to shift gears a little bit. I'm going to,
Okay.
in just a minute, I'm going to hand over to Marie. Before that, I do have a final question from me to you, John, which is, what excites you most about the future?
Well, I think, what excites me is, a couple of things. I remember I had to, a couple of weeks ago at the 30th anniversary of Chime, which is a healthcare CIO profession. And I was the founding chairman of the board of it way back when, is to sort of reflect on 30 years of the evolution of the IT leadership. So, well, when we first, early in the 60s and 70s, the IT focus for most organizations was really back office. Take care of the accounting, take care of the supply chain. Lots of good happened, but it was really back office. And then there was another era which began to be more closer to the customer and to the frontline workers, which is process automation. Help the lab process tests, help pharmacy keep track of medications, et cetera. Then you began to see in the late 80s, early 90s, actually where IT was being used as a competitive asset. American Airlines created a travel reservation system. USAA, which is an insurance company, had a way of submitting claims. Also, it was become part of their strategy was to launch an IT-based product or services. And also, it was in the boardroom and it was in the C-suite for the first time. And now we're in this era where that's still the case, but that was largely done by brick and mortar, existing players. And now we're in the case where we have players coming in who are purely digitally based. That's where they start. And we have brick and mortar taking much more bold and adventuresome. So we're now at a point where we're actually sort of really changing across healthcare, across all industries, the very fabric of what it means to be in these industries, et cetera, and with this incredibly strong IT core. That's just very exciting, is to see that front row seat on this transformation and see all this technology, which is unbelievably powerful. Being able to do things we just couldn't imagine doing 10 years ago or 20 years ago, et cetera. And you and I know, healthcare is a very complicated industry, but nonetheless, it's very personal. All of us have had exposure, either ourselves or someone close to us. And we know that on the one hand, there are really impressively skilled and amazing doctors and nurses and other healthcare professionals who are really, they're just wonderful on many levels. On the other hand, as a system, it stinks. It's really broken, it's confused, et cetera. So we may be finally at the place where we can actually do a lot of fixing this. It'll take time or whatever. And that's just exciting to have arrived at this moment where we can actually take the healthcare we've always wanted to have and begin to make it a reality.
Definitely very, very exciting times, John. It's an area that touches the entire population, and it's exciting to see a few things. One is the rapid rate of transformation and how it's impacting patient care and access. And then it's very, very exciting to see all the new changes. So with that, we are going to shift gears now. I'm going to hand over to Marie. She's going to talk a little bit about the program as well. Over to you, Marie.
Thank you so much for being here, both Professor Glasser, Ronell. Thank you for walking us through digital transformation healthcare, sort of those trends, opportunities, and challenges. So certainly an honor to learn from you both. We're going to learn more about this program and other opportunities for you to continue advancing your lifelong learning. So thank you all again for joining. I know we did think a lot about this program and making sure that it was convenient and accessible, particularly for full-time working professionals, for those of you with busy schedules. So for folks looking to learn more about the logistics, the dates, the times, the scheduling, one thing to note is this program is a blend of synchronous and asynchronous learning. In any of those synchronous components, so any components of the program where you're learning together at the same time in the same room, those are office hours. Those are all recorded and posted into the platform the next day, similar to today's webinar. So if you do have to miss one of those live sessions, you'll have a chance to have that simulated live experience for the remainder of the program. So that just kind of a disclaimer there. Most of the other components here are asynchronous, and we're going to tell you all about them here in just a moment. So stay on the line. We're going to learn more about the learning experience. As you're thinking about those dates and times, please do get connected with a program advisor. So certainly get connected. They're closest to those details, and they can give you the dates and the times and any other of those sort of course registration and enrollment details that you might need. So what sources and techniques have you found the most helpful to get and then internalize those insights? It's a broad question and a really good question.
Yeah, I think one of the things is it's a great question. And one of the things is to realize that that's the case, and to realize that that is an asset, and they have a bunch of people who know this. Now, it's a little different if you're buying, holiday presents than if you're saying, I need to talk to someone about a worrisome cancer that I might have. It's just a different kind of conversation that's got to go on. That being said, I think part of the question is you can imagine in the context of, well, we've got a digital front door strategy, for example. We want to improve the service experience. So we want to have a conversation, and we're partnering with you, Google or Microsoft or Apple or whomever, about your thoughts about how you do that. What can we learn from you about what that looks like and the ways to make that happen? And, sometimes the lessons are pretty straightforward. It's not just the technology, but it's the processes behind it. So I can make it easy for you to pick an appointment, but I can block certain things out that just make it really hard to do because I'm protecting protecting the provider's schedule here. So I think you have those conversations, not only with the tech giants, but also, frankly, with some consulting firms that are pretty darn good at these things, as to how one could, go off and do this. Similarly, one of the things I think about AI, I actually think we'll see a lot of AI in the near term going after administrative processes, prior authorization, utilization management, coding. This notion that the AI is going to challenge the doctor's decision, except perhaps in radiology, is pretty remote here. But nonetheless, you can have conversations with these tech giants about where do you think the AI is really going to have the most impact in the nearer term, et cetera? How do you deal with bias? There's concern about AI algorithm bias. It favors Caucasians, but it truly struggles with Asians or African Americans or Latinos. So, long-winded way of saying, I think he said we have a challenge. There's this thing we're trying to get done, and we're going to have a discussion with our partner, and could be one of the tech giants, about how best to leverage their knowledge and their experience, realizing there's differences. There are real differences here. How do we leverage that to improve what we're trying to do here? And they also, not only does that help you be a good customer for them, they learn from you too. They're trying very hard to learn about healthcare in a specific. So that's a long-winded answer to a very good question about how to leverage them to, not only here, but also cloud computing or AI or a variety of things which are relatively new to you.
And if I can ask, we take a step deeper there as we think about sort of sociopolitical factors at play, as we think about sort of the broader context, and in particular economic recessions. How is it that digital transformations and digital technologies are playing a key role sort of in this larger sociopolitical and financial environment?
Yeah, I think, and that becomes part of the strategy conversation at the highest level, boards and C-suites, is how do you factor in the fact that we may be on the verge of recession, or that we obviously have conflict in parts of the world, et cetera. How does that factor in? And it's usually a complicated answer. On the one hand, what you see with particularly concerns of recession is that a lot of organizations say, well, it better have a real hard ROI or we're not doing this. We don't have time. We don't have the luxury of doing this visionary stuff. We'd be very cautious of costs and very cautious of revenue. And so they'll retrench in a level. And what you do there is have a long-term vision of a transformation. Are there initiatives within that satisfy those kind of criteria that I can go ahead and proceed upon? I may have to reshuffle my sequence here, but I'm going to go off and do that because I have to acknowledge the reality of today. But at the same time, what I don't want to do is sort of forego or take too much of a pause in my transformation. Because one of the things that happens is competitors can catch you and go by you if you spend too much time, hiding or pulling your, like a turtle pulling its legs in, et cetera. There are other organizations that will say, now's the time. Well, everybody else is retrenching. Now we're going for broke. We're going to grab share. We're going to move fast, et cetera. And so that becomes a conversation that says, while they're all doing hard ROIs, we're going to push really, really hard on this stuff and grab share, learn all kinds of stuff that's got to go on. So it's a very complicated decision set going. And I think the other point here, I mentioned it before, transformation never stops. You are never done. Why? Because the circumstances 5 years from now will be different than those today. None of us 5 years ago would have said, hey, I'll bet you there's a pandemic coming. I'll bet you. And we should prepare for that. All of a sudden it's here. Or that there's war in Ukraine and its impact on global energy supplies, et cetera. So I think this is an ongoing conversation that happens, considering external factors and what do we do, but not losing sight of the transformation that we have in mind, because the one way to get in trouble is to stall for too long a period of time.
Absolutely. And I think, one of the important things that you've done here in this program is providing those ongoing learning opportunities so that folks continue to stay relevant and modern, current, up to speed. And a lot of what we see happening on this webinar, folks getting to know one another, sharing across ideas, a lot of that is happening in the program as well. And it's one of those big sort of softer returns on your investment, or sort of a hidden curriculum, is that chance to really build out your peer advising network as well. So as you're talking about the different impacts here as we think about digital transformation in this broader ecosystem, so certainly hospital funding is complex. And as we think about investing in digital transformation and technologies, where do we find the funding? But maybe we broaden that out a bit further and we say, how do we really, build that coalition of support and really help our organization to be investing and thinking about digital technologies if it isn't already?
Yeah, I think a couple things. Let me just double click, so to speak, Maria, on your comment about your colleagues, et cetera. One of the really cool things about these kinds of programs is you meet people from all over the world, and that's just really neat. And what you realize is they teach you. You know, you can learn from people trying to deal with childhood mortality in sub-Saharan Africa. Even if you're sitting in New York City, you can learn from that. So there's a lot to be learned. Plus, you could form these long-term relationships and friendships because 2 years from now you'll say, "I'm going to call that person. He or she was really smart and to reach out." So, and not only that, one of the things we do along the way, if you're building out your plan, is you put it out in a discussion board for feedback from your colleagues. And your colleagues will say, "I'm wrestling with something similar. Here's what I would do," or "Let's get on the phone and talk about this." So I think one of the great intangible, but incredibly powerful and incredibly useful is meeting some really neat folks who are engaged in similar challenges, even though they're, across parts of the globe and across parts of the country here. I think getting the funding is complicated. And it's true for this. This is true for building a new building or opening up a new, line of therapeutics. If you're in a drug company, et cetera, you're making an investment and you do all your homework about why it's important, et cetera. But there's a lot of uncertainty about all this stuff. So what do? I mean, what you do, one is to your point, you build a strong coalition of people who are interested in making this happen. And so you shop it, you talk to people, here's why, you make sure that people, they may not be fully on board, but they're supportive of this. So when you go into the budget discussion or the board discussion, you have as much political support as you possibly can. The second, you've done as much homework as you possibly can about why this is important. And sometimes think you defend stuff in boardrooms on a number of criteria, one of which is pure numbers, the good things going up, bad things going down, revenues, et cetera. It's self-funds or improved service levels, et cetera. Sometimes you say it because our rivals are doing this. And people say, we can't let those guys get ahead of us. And it's a very testosterone-laden response. It's competitive, but it worked. Sometimes it's an emotional response. I'll never forget, years ago, going in front of the Mass General Brigham Board with a lot of money being requested for patient safety. Now, we could have done the numbers. You've probably seen these numbers, 747 crashing every other day, just terrible numbers. Instead, we went to the boardroom with a doctor and a woman who is 32, mother of 3. He had overdosed her, sent her into a coma. She almost died. He talked about the devastation he felt. She talked about the devastation her family felt. It was an emotional response. And you had to be inhuman not to approve that money as we went through here. So we talk about different approaches to getting it funded, et cetera. The next point I'll make, and probably the last point here, is you can have this lofty vision, and that should be lofty. Remember, it's business model. It should be lofty. That being said, you're not going to get there tomorrow, and you're not going to get there next year. So you say, what can I do this year and next year? So bite-sized chunks that we think we can afford, we think we can pull off, we think we can measure. So even though the aggregate is in some ways fuzzy and uncertain, the what to do next year is not. And so that helps people feel good about the money, feel good about the likelihood of a strong outcome, and feel good about the certainty of making it happen, et cetera. So we talk about a variety of approaches that can be put together to get the funding of this kind of stuff here. You got to be careful. I remember having conversations with my daughters, all now in their 30s and all with kids, et cetera. When's the right time to have a kid? There's no such thing as the perfect time to have a kid. Okay. So, you're going to make up your mind and go on a number of these types of things here. So I'm not sure that's the best analogy in the world, but it's what I thought of at the moment.
No, it's exactly right. And I think, programs like this, learning opportunities like this, chats like this one here, all of those things are available out there for folks who are really looking to explore these themes, and really, really great questions here. And this is the kind of engaging discussion that you can expect here in the program. So thank you again, Dr. Glasser. I know you're going to be staying on here with us through the end, so we'll invite you back in one more time for final closing remarks. But first, we'd love to describe the program a little bit. So we want to spend a few minutes diving into the learning experience, giving you a few details there. And then again, as mentioned, we'll hear from Dr. Glasser one more time before we close out at the top of the hour. But this program here coming up, Leading Digital Transformation in Healthcare, you'll see there's a QR code there. You can use your smartphone and hold it right up to that QR code. You can also use the link there on your screen and go right over to the course website where you can learn all about this program and begin that application process. process. But let's go ahead and describe a little bit about this course, give you a little bit of those details up front here. Firstly, who is this program designed for? This is really the crux of why you're here. Is this program right for me? So this slide really dives into who we had in mind when we put this course together. And as you can see here, business leaders who are responsible for leading technology-enabled change initiatives in healthcare, change makers in healthcare industry involved in digital initiatives, chief information officers, and those with digital related patient experience, purchasing, sales, product management, anything that a patient will touch. So of course, this gives you a lot of those upfront details, but if you have any questions related to program fit, if you think about your challenges, the projects you're working on, your career goals, please do let us know here in the question box. Is this course going to be relevant in my geography, whether you're in Europe or Asia or the US? And this course was designed to be sort of geographically agnostic, giving you those tools and frameworks that you need to apply within your industry. But certainly as you want those more detailed or granular details about the program, the geography, and other contextual information, certainly reach out here to a program advisor and they can help walk you through more on that. But those overarching learning objectives, you're going to be able to walk away from this program with an understanding of how digital health and other forces are converging to shape healthcare ecosystem. You'll recognize the lessons learned about barriers and success factors from real-world digital health transformation experiences and pilots. You'll identify those elements of effective change management, really bringing to life your learning into a place of real-world application. You'll gain those insights, best practices for that day-to-day strategic priorities. And you'll, of course, be able to engage in this learning environment and bring your learning into your actual profession, your actual industry or organization. So as you're setting the stage in the program, you're integrating that with your professional role as well. So here by the end of the course, really being able to engage that full network, faculty, participants, and others as key sources of knowledge, feedback, and support moving forward. So those are all of those takeaways here in the program. Again, as mentioned during the discussion, this course is taught by a full team of professionals here, each offering their own advanced level expertise and insights as you make your way through the learning experience and really gain that holistic understanding here. The learning experience includes those live expert presentations. Again, the schedule for that, you can get that from your program advisor, and all of those live sessions are recorded so you can have that simulated live experience right there in the platform at any point in time after the session. There are readings, pre-works, class debates, case studies, small group discussions, all of this really aimed at helping you to engage and interact with the content. What you'll see here on this slide really is the key to what sets this program apart from simply reading a book or watching a video on YouTube or learning about this in a static sort of open enrollment program. This program is a highly specialized program that really challenges you to interact with your learning while you learn. And that's really what you see represented here. You're not only gaining those methodologies, those frameworks, and those learnings here from world-renowned experts, but you're being asked to really roll up your sleeves and engage in the learning process. Engage in live discussions and peer debates, and really take part in a reciprocal learning environment. And so that's what we want to showcase for you here, what that looks like. The platform includes these live expert presentations, case study analysis that challenge you to take a real world scenario and really examine it from multiple different aspects to lift from there key learnings. You'll engage in class debates and group discussions, a chance for you to turn on your audio, turn on your visual, and really engage in these core themes. You'll see here on the right, these are the discussion boards. So as you and your peers are sharing projects and ideas, you'll have a lot of support here on the discussion board. All of this is facilitated by a learning facilitator. So in addition to your peers, in addition to your faculty, you also have teaching fellows or learning facilitators, if you will. They're on the discussion boards here. They're hosting these live discussions and debates. They're giving you individualized feedback on all of your assignments. So you're not just submitting assignments for completion, you're submitting them to your facilitator, who's really a part of that day-to-day learning experience from the moment you enter the course. You have access to the program for an entire calendar year. So all of the readings, all of the discussions, videos, beyond that intensive learning, you'll have that entire calendar year to touch back into the content and to continue learning and applying your learning. And of course, as many of you know, you do have a chance to formalize your learning here and earn a credential from Harvard Medical School Executive Education. This is an online certificate here, a digital certificate you can post on your LinkedIn, on your resume. And really, again, it showcases your learning and it formalizes your training here in this area of leading digital transformation in healthcare. So certainly a chance for you to broaden your professional network, gain peers and colleagues, gain a broader toolkit of learning that you'll be able to apply right away in your organization and in your field. And of course, all of this as you work to earn this credential and advance into career opportunities. So for those of you looking for career advancement opportunities, a big part of what you'll be doing in the program as well is reaching out and building your professional network, and your learning facilitator will help with those job and career prep questions as well. So a lot of opportunity for you to get support. We want to make sure that that high level of support that we talk about in the program begins today with getting you connected with an advisor. That is your next step to learning more. You can go on over to the course website. Again, you'll see that link here. We'll also post that for you in the chat box one more time so that you have it there. But go over to the course website. You'll see everything we've talked about here and more, and you'll also see a chance there to get connected by scheduling an appointment with a program advisor. They can help walk you through the schedule, course policy details, like how you earn that certificate. And of course, they can help you with any of the registration and enrollment information you might need help with. We do have an early enrollment benefit, special group enrollment discounts, a robust referral system, a generous open enrollment extended period of 21 days where you can apply for a full refund. So a lot in store as you think about touching into this program and getting started. We hope you'll connect with an advisor. For now, though, we are going to be closing out the session here in just a moment. So we invite you to go ahead and open that chat box one more time if you haven't done so already, and pick up the link there to the program page. You can also grab the email address if you prefer to use it, harvardmed@emeritus.org. Let us know what you need, and we're here to support you. And with that, Dr. Glasser, I'd love to invite you back into the frame here. I'm going to stop sharing my screen one more time. Both Renelle and Dr. Glasser would love to hear any final closing remarks from you both. Professor Glasser, thanks again for being here. Any final words you'd like to leave us with today?
Yeah, first of all, Marie, thank you. And Renelle, thank you. And thank all of you for attending this. I hope this was informative, useful, and look forward to seeing you in the class. I mean, just a final comment. Healthcare is very personal to all of us because of either us or our family members, et cetera. We know the reality. We know how much it matters. We also know, again, there's extraordinary caregivers, doctors and nurses, physical therapists, et cetera. But we also know it doesn't work very well a lot of the time, too often part of the time. It's very clear that the technology can make it a lot better, perhaps even excellent in a number of cases. And that's kind of what we're all about here. And it's tricky. It's hard. The two hardest industries to transform are education and healthcare, for all kinds of reasons. You'll learn more about that in the course, but for all kinds of reasons. And one of the tricky parts, I'll give you one example of a student of mine who set up a company to monitor middle-aged men who had had a heart attack. He wired them up with sensors and they sent in readings, et cetera. And I said, well, how did it work? And he said, well, the technology worked fine, but the major thing that helped a middle-aged guy, do his therapy, the types of steps he needed to take after a heart attack, was the degree to which he felt that the care team cared about him. So we just have to remember that the technology is important, but we'll have to blend that skillfully with what it means to deliver care and how the human aspects of it. And that's going to be our challenge. But nonetheless, I think we will rise to that challenge. And nonetheless, I think all of us collectively will make healthcare the thing we want it to be in the years to come for ourselves and for our families and for all those who matter to us. So thank you again for being here.
Thank you again, Dr. Glasser. Renelle, any final thoughts you'd like to share as well?
Absolutely. No, very exciting time. This is a hot topic and highly relevant. Really appreciate, John, you taking the time and taking the lead in creating this program. So very pleased for that. And thank you all.
Thank you as well. To our audience, thank you for joining here today. Welcome to this global community. We hope to see you back soon in one of our upcoming events or programs. But for now, we sign off with a heartfelt good morning, good afternoon, good evening, and good day. We'll see you back here soon. Bye-bye.